Hi, my name is Taylor Moylan and my project is on vertigo. So what is vertigo? Vertigo is a sense of rotation, rocking, spinning, or giddiness when someone is standing perfectly still. It is often associated with looking down from a great height, but can refer to any temporary or ongoing spells of dizziness by problems within the inner ear or the brain. This feeling may be barely noticeable, or it may be so severe that you find it difficult to keep your balance and do everyday tasks. It is important to distinguish that vertigo is not the same as lightheadedness. For those who cannot quite grasp the understanding of what vertigo is, you can create a sense of vertigo by spinning around. In fact, by doing this, you are creating a sense of induced vertigo, which lasts for a few seconds and then disappears. Vertigo can be temporary or long-term and ongoing in spontaneous bursts. What causes vertigo? Vertigo is mostly caused by an issue within the inner ear or the vestibular nerve. About 93% of cases of vertigo are peripheral vertigo, and this is caused by the following. BPPV, known as benign paroxysmal positional vertigo. This type of vertigo is characterized by brief periods of vertigo triggered by a change in position of a person's head relative to gravity. The second cause is vestibular neuritis, which is an acute peripheral vestibular dysfunctional syndrome and is characterized by rapid onset vertigo, nausea, vomiting, and gait instability. The third cause is Meniere's disease, and that is typically characterized by vertigo which occurs in episodes and followed by vomiting or nausea lasting minutes or hours. The likelihood of one having vertigo increases with age. Vertigo has a high prevalence in the world population, affecting about 2% of younger adults, 30% in older adults over the age of 65, and 50% of the elderly above the age of 85. As you can see, your chances are linear and increase with age. Lack of regular physical activity or low levels of physical fitness are also considered risk factors for vertigo because they cause various symptoms such as dizziness. Other factors include recent ear infections, which contribute to imbalances within the inner ear, history of head trauma, cardiovascular disease, and medications such as antidepressants or antipsychotics. All the following increase your risk of acquiring vertigo throughout life. A person with vertigo will have a sense that their head or their surrounding environment is moving or spinning when in fact they are standing still. Vertigo is more of a symptom rather than a disease itself and is often a symptom of other conditions, but it can also have its own set of related symptoms. The symptoms of vertigo include a sense of spinning or moving, and upon physical examinations, it shows abnormal eye movements. Less often, vertigo may be associated with head or neck injury, brain problems such as stroke, and certain medications that cause ear damage, or migraine and headaches. Some other symptoms include nausea, vomiting, headache, stumbling while walking, which is gait instability, sweating, ringing in ears, or again, the rapid or jerky movement within the eyes. Treatment for vertigo usually depend on what's causing it. In many cases, vertigo goes away and the symptoms lessen. These are some of the following treatments for vertigo. The first is vestibular rehabilitation therapy. This is a type of therapy aimed at helping strengthen the vestibular system. The function of the vestibular system is to send signals to the brain about the body's movement relative to gravity. Exercises performed in vestibular rehabilitation therapy help improve your inner ear balance, and those help fix the problems such as dizziness and abnormal eye movements. The second type of treatment is called canal repositioning procedures, also known as the Epley remover. The Epley remover includes procedures to help aim to help put an end to false signals that are being sent to your brain. The Epley remover is usually treated for BPPV, which is again known as the benign paroxysmal positional vertigo. The movements are meant to reposition the head and fix the misplaced canals within the ear that have entered the semicircular canals within the inner ear. The movers must be performed by a professional because it can cause abnormal eye movements, which can cause other symptoms in the patient, such as dizziness or headaches, so it must be monitored. VBAs are known as vestibular blocking agents, and they are common medications that help people with vertigo. Some examples are antihistamines and antiemetics. So as I said earlier, 3 causes of vertigo are the benign paroxysmal positional vertigo, and to usually help treat this type of vertigo, you would use, as I said, again, the epilepsy remover, which again loosens the calcium crystals within the inner ear and clears them from the ears. For the peripheral neuritis, bed rest and VBAs are recommended, and for Meniere's disease, bed rest, antihistamine medications, diuretic medications, and VBAs are recommended. Exercising with vertigo can be intimidating and in some cases fearful because of an increased risk of falling or the chance of intensifying the symptoms of vertigo. Those suffering from vertigo are still able to perform physical activity as long as it does not increase or intensify their symptoms. Their program should focus on improving balance in a variety of vestibular rehabilitation exercises. Balance exercises should be done in 30-minute sessions about 3 to 4 times a week because it is very important. Some balance exercises include the Romberg exercise, standing sway exercises, marching in place, turning in place, and head movements while standing. Resistance exercises are still advised for patients with vertigo. It is suggested to lift 50 to 60% of your 1 RM max for about 2 sets of 10 to 12 reps. And it is very stressed that when patients are exercising with weights who have vertigo, to be mindful and careful of the risks while training with vertigo due to the symptoms and the dangers that can be present around weightlifting. Aerobic endurance exercises are also suggested for patients in vertigo. Cardio exercises can be done in 30-minute sessions about 4 to 5 times a week. Cardio done while sitting is recommended due to increased safety measures. While running with vertigo, one should be cautious of increased symptoms due to the increased stimuli and dual movements and dynamic movements that could lead to a risk of falling and other related injuries. Some other types of specific exercising for vertigo to help treat your symptoms as well is one of them is gaze stabilization, and this helps control your eye movements better so your vision can become more clear. The exercises are performed by fixating your eyes on a specific object while moving your head back and forth or up and down for a few minutes. Another exercise of gaze stabilization includes the use of body sense to substitute for the vestibular system that's damaged. Balance training exercises, again, are very stressed, and they depend on what type of balance issues you are having. The recommended exercises that I'm about to list will help you improve your steadiness and your gait stability as well. The balance training exercises will help improve coordinated movements, dual task, as well as dynamic movements. Habituation exercises serve the purpose to decrease the feeling of dizziness. They are done by exposing you to the feeling of being dizzy over and over and over again. The exercises accomplish this by promoting dizziness through visual stimulation and certain movements. So now on to a case study. We have a 48-year-old female who lives alone. She's complaining of intermittent daily bursts of dizziness, nausea, and constant spinning that prevent her from completing her daily living activities. She also complains about how quick head movements increase the feeling of dizziness and instability. The episodes range from lasting several minutes to an hour, and in severe cases, end in vomiting. The patient's history includes high blood pressure, thyroid problems, allergies, sleeping difficulties, neck and back pain, severe and frequent headaches. She also stated that she is currently on 2 types of medication, Synthroid, which helps for her thyroid problems, and Lispronol, which is an ACE inhibitor, which helps with her high blood pressure. Upon examination of the client, we found that her blood pressure is 134/70, which is high. Her BMI is above normal, 27.44. She is a non-smoker, and she has no family history of cardiovascular disease. Upon analyzing her gait stability, we noticed that there was a slight deviation to the left of her path, which was caused by dizziness and this vertigo. Also, upon examination, we noticed rapid and jerking eye movements within her eye. The following limitations were discovered by talking with the patient. When she looked up, she felt very dizzy, and on a scale of 1 to 10 of her dizziness, it was about a 5 out of 10. And this caused frustration. She noted that there are limitations in certain participation in social activities such as dancing and going out with friends, because standing for long periods of time or constant moving increased her symptoms of vertigo. Household chores and strenuous yard work also intensify her symptoms, so she finds it hard to complete them, and thus hard to complete her daily living activities. She avoids heights because they always make her feel dizzy. Turning over in bed wakes her up, makes her feel uneasy and uncomfortable, and she has complications of walking in the dark and bending over and concentrating for long periods of time. The patient's symptoms point and relate to vertigo with benign paroxysmal positional vertigo. Further, upon examination, cervical flexion and extension motions increase her nausea and dizziness. Thus, she has limited cervical range of motion. The patient also presents a high fall risk as evidence of her inability to maintain balance with eyes closed in a tandem position. The patient will benefit from BT as well as exercise to help restore the deficits and return to full function. Treatment will include lower and trunk strengthening exercises, balance activities with multiple distractions, and we will progress through them. For example, I will have her stand on one leg for a long time, and once she starts feeling more comfortable with that, I'm going to add another stimuli, such as tossing a ball back and forth or closing her eyes and tapping from either side to help her with her balance. She will also have the epilepsy remover performed on her. The client should, as well, for her exercise prescription, do aerobic activity at least 4 to 5 times a week, depending on the symptoms of vertigo. Depending on her symptoms of vertigo, the type that she may do may be limiting. She should do light activities such as walking, swimming, or the cycloergometer, something that does not have an increased stimulation that could increase her symptoms, such as stairs or sprinting. Resistance training should be done 2 to 3 times a week and should focus on her lower extremities and trunk. We want to strengthen these muscles in particular to help her keep her balance and prevent falling, which could lead to increased injuries on the wrists, the hips, or even the legs. We would also like to note that she should avoid doing heavy weights, and we would like her to do more body weight, such as lunges and body squats, to help her also decrease the risk of injury while exercising. And due to low cervical range of motion, the patient should perform flexibility exercises at least 2 to 3 days a week, and this could include yoga and the other previous balance training exercises I listed. And I would like to note that she should not be doing really fast, rapid movements right away because they could trigger her symptoms and make her vertigo worse. We would like to progress to that point. As well as part of her treatment, I would like to educate the client on her condition as well, with safety precautions and just what BPV is, because it is important for clients to understand the full background of their disease so they can manage and cope with it. And this is the end of my presentation, and here are my citations. Thank you.